The fly, a new objective assessment and treatment solution for deficits of movement control in the cervical spine. Introduction and setup. The fly is a new clinical method that assesses the ability of patients with neck pain to correct cervical spine movements on a moment-to-moment basis. The method has been recently reformed and will be made available in a clinical setting both as an assessment and a treatment method. The following instructions are given to the patient before the test. A fly derived from the computer program and a cursor derived from the sensors on your head will match each other in the center of the computer screen at the very beginning of the test. Then the fly will start to move. You will be required to follow the fly with the cursor by moving your head and neck as accurately as possible. To familiarize yourself with the test procedure, you will be asked to trace one movement pattern once. The assessment part of the fly. The assessment part has 3 outcome measures, each of which represent 3 different aspects of proprioception. Amplitude accuracy is indicated by mean deviations of movements in millimeters plus or minus 2 standard deviations. Directional accuracy, or time on target, undershoots versus overshoots are each indicated as a percentage of the total time used to perform the trial. Jerk index is the 3rd outcome measure and calculates the smoothness of movements, indicated by an index from 0 to 10. Treat your own neck. The fly exercise program. The treatment part of the fly method is essentially a new computer-generated exercise program designed to improve coordination of cervical spine movements. The patient is asked to trace incremental difficult movement patterns. For that purpose, the exercise program contains 3 banks or classes of movement patterns: easy, medium, and difficult. One or more of the following variables can be chosen as an extra option to make an exercise trial easier or more difficult. The size of the trajectory can be diminished or enlarged, resulting in smaller or bigger ranges of movement. The direction of the fly can be reverted. The size of the fly, normal size, one smaller and one bigger size can be chosen. The velocity of the fly, normal velocity, one slower velocity, and 3 faster velocities can be chosen. When the patient clicks the Get Pattern button, 9 exercise patterns are displayed in random order on the screen, which make up one treatment session. Feedback during and after an exercise trial is an essential part of the fly exercise program. The following feedback is given. 1. Results of performance. The patient is given constant feedback while performing the exercise trial. The cursor changes color according to how close or far the cursor is in relation to the fly. When the fly and the cursor are in close approximation, the cursor is green. When the cursor is behind or ahead of the fly, the cursor is yellow or red respectively. This feedback indicates the directional accuracy of the cervical spine movements. 2. Results of outcome. The results of outcome on completion of the test are shown in 2 ways for the patient. Firstly, by displaying a column which indicates in percentages A, the time on target, indicated by the green color, B, the time behind target or undershoots, indicated by the yellow color, and C, the time ahead of target or overshoots, indicated by the red color. Secondly, the trajectory of the fly pattern and the pattern traced by the patient is displayed graphically after the exercise trial is finished to visually express the patient's amplitude accuracy. The blue color represents the path traced by the patient. After 1 or 2 weeks with daily or every other day 15 minutes of training, reassessment is performed, which will decide whether the patient can start on a more difficult stage in the exercise program. The Head-Neck Relocation Exercise Program. The Head Neck Relocation Exercise program is not finished yet, but will become a part of the Neck Care unit as a plug-in. Audio-video sequences will be used to design this program through animations of each exercise sequence. The program will be divided into 3 incrementally difficult classes: easy, medium, difficult. Each part consists of read instructions and animations. The transferal of each part is estimated to take a few minutes. Each part will be divided into several spells. This program will be launched next year.